Angelicus and Welcome everybody to episode 75, 3/4 of a century of Spurbs Herbs. Seems that way, but it doesn't. So this is a milestone, episode 75. Today we're going to be talking about a very interesting herb called Gou Teng. Gou Teng, Uncaria Ramulus cum Uncis, or Uncaria or Gambir. This is, one of the colloquial names I heard was fishhook, and it looks like a fishhook. It's just a great herb, very commonly used. Well, I don't know about very commonly used. I would definitely say commonly used. I don't know about very commonly used, but let's get into it. Today we will be exploring this interesting Chinese herb, Gou Teng. This herb is a relatively commonly used herb in the Chinese medical category of substances that extinguish wind and stop tremors, and can be used in a wide variety of conditions, including spasms and convulsions, headache, irritability, and it says here, I have written, and even hypertension. It's not even hypertension. That's a common use of this. This is probably one of the first one or two herbs you think about when treating hypertension. Very commonly used for hypertension. And as usual, we will be exploring something a little different. We are going to continue our discussion about macrominerals by looking at sodium, chloride, and magnesium. Please stay tuned for this intriguing episode. And I've asked this question a few times. It's time for me to change it, but I'm still going to ask the question, did you know that I've written a couple of books? The first book is Integrative Pharmacology, combining modern pharmacology with integrative medicine. This is a pretty thorough book discussing pharmaceuticals, what they are used for, how they work, and how they may interact with other drugs, herbs, and supplements. It is the perfect reference book for all acupuncturists, herbalists, chiropractors, naturopaths, and really any integrative practitioner. But it's also perfect for anyone. It goes in depth, but is easy to read and has difficult terminology bolded with definitions on the same page. This is not only a great book explaining pharmaceuticals, it's also available at an amazing price. It is available for 10% off its regular price, and you get it signed by me, the author, for just $67.45. And I'll put whatever you want up, reasonable, on there on the signature if you want. Just put it in the comments, and I'll make sure it happens. So happy to do that. My second book, written with an amazing insurance expert, Tiffany Anderson Hefner, is called Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. This is the perfect book for any acupuncturist who wants to or is contemplating accepting insurance. It gives step-by-step advice at every part of the insurance game, from getting set up through the patient encounter and, of course, getting paid. All in easy-to-digest language, honest advice, and lots of hand-holding through the process. And you guessed it, it is also 10% off and signed by one of the authors, me, all for $26.98. You can get either or both of these books at the shop at www.spurbsherbs.com. So in our last episode, we looked at calcium, the most common mineral in the body. This was based on my new webinar series called Integrative Nutrition, where I explore the biochemistry, Chinese medical approach, and supplements available of various topics of nutrition. Today we're going to explore three more super important macrominerals: sodium, chloride, and magnesium. We're going to talk about their biochemistry, Chinese medical properties, and their supplementation. So we're going to start off with sodium and chloride, which are discussed together because they are used in similar processes, and the primary dietary source is the same, table salt or NaCl. They are used to maintain water balance, osmotic equilibrium. This means pressure especially in the blood vessels, acid-base balance, and creating the electrical gradients across cell membranes necessary for nerve conduction and muscle function. They are both primarily extracellular electrolytes. In other words, they exist outside of the cells. Sodium, or Na+, can be used for transportation, such as intestinal and renal absorption and reabsorption of glucose, galactose, and amino acids by sodium-linked transporters. Chloride is also combined with hydrogen to form hydrochloric acid in the stomach. Sodium intake can increase blood pressure from stimulation of brain thirst centers and secretion of antidiuretic hormone, causing retention of water. Both hyper and hyponatremia, or too much or too little sodium, can cause brain damage. Neither sodium or chloride have an RDA, recommended daily allowance. So that's interesting. None of these you need to worry about an RDA. You get plenty. The adequate intake for chloride is 1,800 to 2,300 milligrams and is 1,500 milligrams for sodium in adults. Now, just to give you an idea, most of us, it says 1,500 milligrams are adequate intake. So the difference between RDA and adequate intake, and RDA has lots of science behind it. Adequate intake has not quite as much science behind it. It's still enough to create an adequate intake, and it usually is a range, while RDA is a little bit more specific and has more science behind it, but adequate intake is still pretty good. So it says 1,500 milligrams of sodium in adults. Most adults, especially if they're eating any processed foods whatsoever, are probably over 5 grams, 3 times what is adequate intake. Not healthy long term. So what do sodium and chloride do according to Chinese medicine? Bob Flaws in his book, The Tao of Healthy Eating, says sodium supplements the liver and kidneys and secures the essence, softens hardness and scatters nodulation, and he does not have an entry for chloride. Pitchford has a lot to say about salt. It has a dual nature and it oscillates between its aspects in the human body. Its yin nature represents the earth, and thus salt can be used to bring a person down to earth or to give food an earthy, more substantial quality. It strengthens digestion and contributes to the secretion of hydrochloric acid in the stomach, an earth element organ. So just right there, secretion of hydrochloric acid, it's already implying that he's talking about sodium chloride because they often go together. In the outer dimension, salt enables one to focus more clearly on the material realm. Excess salt, in fact, is thought in Chinese folklore to encourage greed. At first, salt is cooling. It directs the energy of a person inward and lower, the appropriate directions in cooler weather. Consistent with its yin quality, salt also stimulates the kidneys, which then promote fluid metabolism and a moistening effect beneficial to dryness in the body. This tonic action on the kidney fluids is especially helpful in the winter, when dryness from the heat-producing activity of the body is at its height and fluids are needed for balance. At the same time, the purifying properties of salt detoxify poisons. Thus, a little salt can help counteract poisoning from poor quality foods and unhealthy food combinations. When the blood is impure, indicated by symptoms such as skin eruptions, salt can be used externally, since its extended internal use for purification is thought to injure the blood, making the complexion lusterless and the muscles weak. Another paradoxical aspect of salt is its ability to soften some areas of the body and tighten others. For instance, salt softens hardened lymph nodes, glands, and muscles. It also promotes bowel action. Abdominal obstructions and swellings can be softened or dissolved by salt according to traditional Chinese instructions. Yet salt may create pressure in other areas such as the arteries. Because salt has an affinity for water, a large percentage of sodium settles in the vascular fluids of the body. As this sodium attracts more fluids, the pressure in the vascular system can rise. This is one reason salt is contraindicated in cases of high blood pressure. Since most instances of high blood pressure not only involve arterial problems but are also closely related to excesses of the liver, very small amounts of whole salt, ideally in the form of seaweeds, can help detoxify the liver once poor quality and fatty foods are eliminated from the diet and the blood pressure is out of the danger zone. From the viewpoint of Chinese medicine, salt benefits the kidneys, but its overuse damages them, leading to emaciation, weakened bones and blood, and deficiencies of the heart and spirit. And as we've been talking about supplements, neither sodium or chloride are used as supplements. There used to be salt pills, if you remember back in the day, and the thought was if you're out, they would give them to troops when they're out in very humid weather and working. They thought salt was given out, so they were given salt pills. Those are no longer valid. The equivalent these days would be Gatorade, which has quite a bit of sodium in it. Those would be electrolytes in that case, though generally we don't have to worry about supplementation of sodium or chloride on any long-term basis. Let's talk a little bit about magnesium, or Mg. 1% of bone mass is made up of magnesium. That doesn't sound like a lot, but that actually means there's quite a bit of it in the body, especially since 60% of magnesium in the body is in the bone. So that's quite a bit. I mean, bones make up a lot of our weight. It is important in enzymatic reactions in the body, including kinase phosphorylation and DNA and RNA polymerases. The adult RDA, recommended daily allowance, is 310 to 420 milligrams, and the average intake in the U.S. is below the recommended level. The upper limit for supplementation is 350 milligrams. So this is interesting here. Now, I just said the adult RDA is 310 to 420 milligrams, but the upper limit is 350 milligrams. So it's a little bit fishy there. In other words, we need more than we should supplement. And the reason why it's that way is we should be getting it mostly from our foods. And it's when we supplement, we should be having a maximum of supplementation, 350 milligrams from outside sources, as opposed to getting it from our foods. Hypomagnesia, which is too little magnesium in the blood, which can result from decreased absorption or increased excretion, can cause hyperexcitability of neurons and skeletal muscles and cardiac arrhythmias, none of which are good. Hypermagnesia, or too much magnesium in the blood, can cause hypotension, so too little blood pressure. According to Chinese medicine, magnesium, and this is from Bob Flaz's book again, magnesium astringes yin and suppresses yang, quiets the spirit, absorbs acid, and stops pain. Paul Pritchford says, magnesium provides the body with a smooth, flowing nature, and therefore is useful for many diseases where there are stagnancies or erratic changes. According to the Chinese healing arts, stagnation accompanied by erratic changes in the body, emotions, or mind represents liver gallbladder imbalance. Thus, magnesium foods usually help nurture one's liver and health in numerous ways. The applications of dietary magnesium nearly all parallel liver gallbladder pathology in the view of ancient Chinese medicine. We do use magnesium supplements, and they come in a variety of formulations, including magnesium citrate, magnesium oxide, magnesium chloride, magnesium gluconate, magnesium orotate, and other forms. Approximately 48% of the U.S. population does not get enough magnesium in their diet, especially men and women over 71 and adolescents aged 14 to 18. Several conditions can deplete magnesium, including alcohol abuse, gastrointestinal disorders, and diabetes. Several drugs may also decrease levels of magnesium, including some chemotherapy agents, diuretics, and proton pump inhibitors. Uses: magnesium may decrease hypotension, help heart health, gout, tinnitus, dementia and cognition, Parkinson's disease, diabetes type 2 and metabolic syndrome, depression, anxiety, osteo and rheumatoid arthritis, insomnia, migraines, premenstrual syndrome, restless leg syndrome, and leg cramps. And we often, whenever someone says they have leg cramps or sometimes restless leg syndrome, but leg cramps, they often will say to me, it's like, oh, I've tried magnesium and it doesn't work. So very commonly well-known use for leg cramps, though I don't think it's the only thing. I think in my experience, most leg cramps have nothing to do with magnesium. Some do. It's definitely useful, but not all of them. Most of them I don't think are magnesium. So what does the science say? Hypomagnesia can cause hypertension, and there is some mixed evidence showing that supplementation may help hypertension. The FDA has approved a qualified health claim for this. It's the FDA, the Federal Drug Administration here in the U.S. And here's the qualified health claim for this. Consuming diets with adequate magnesium may reduce the risk of high blood pressure, hypertension. However, the FDA has concluded that the evidence is inconsistent and inconclusive. So that's quite qualified if you ask me. While hypomagnesia has been shown to increase coronary heart disease and sudden cardiac death, there's no current research showing supplementation will reduce this risk. Gout has a similar story. Those with hypomagnesia are more likely to have higher levels of uric acid and risk of gout, but supplementation has not been studied. Two small studies, N equals 19 and N equals 29, neither of these are statistically valid, have shown magnesium can reduce tinnitus. There is decent evidence that magnesium supplementation can help dementia and prevent both dementia and minor cognitive impairment. Again, all this kind of puts me in the realm of we should make sure we get enough and have a little bit of supplementation, but not too much. Continuing with science, there are several conditions like gout that show a correlation with hypomagnesia, but supplementation has not been shown to help, usually from a lack of studies. These include Parkinson's disease, stroke, depression, arterial calcification, osteoarthritis, and rheumatoid arthritis. There's some evidence that supplementing magnesium can help prevent diabetes type 2, but does not help improve patients who are treating their diabetes. Supplementation also seems to help insulin insensitivity and metabolic syndrome. There is no association between magnesium levels and anxiety. There's some evidence supplementation of magnesium may increase bone mineral density in 70 to 79-year-olds and reduce the risk of bone fracture in older adults. While supplementation may help insomniacs with low serum levels fall asleep faster, they do not benefit. It does not benefit the quality or length of sleep. There is very little evidence magnesium supplementation helps restless leg syndrome or leg cramps. Like I said, I haven't really seen it work. And there's some evidence showing benefit of supplementation for helping migraine headaches and PMS, premenstrual syndrome. Other considerations: magnesium chloride, glycerophosphate, and bisglycinate, also called glycinate or diglycinate, do not cause laxative effect, while magnesium citrate, aspartate, gluconate, and lactate may cause laxative effects at high doses. Magnesium hydroxide, carbonate, sulfate, and oxide are not recommended for supplementation or are better used as laxatives. Dosage: 100 to 200 milligrams to supplement the diet, and 250 to 600 milligrams daily as a treatment. Remember, the upper limit is 350 milligrams a day. So I wouldn't be up at that 600 milligrams daily as a treatment. Upper limits is when adverse effects start to happen. Taking magnesium supplements with food can help reduce the possibility of diarrhea. Taking magnesium and calcium together have not been shown to aid each other. Side effects and red flags: magnesium supplements can cause stomach upset, diarrhea, and nausea and vomiting. Too much supplementation can cause hypermagnesemia, so too much magnesium in the blood, with signs and symptoms of nausea, headache, warmth, flushing, lightheadedness, hypotension, thirst, drowsiness, slowed breathing, muscle weakness, and possibly death. There are some interactions. Magnesium has been shown to have anticoagulant and antiplatelet effects, should not be used with medications with similar effects. Magnesium hydroxide may increase absorption of sulfonylurea anti-diabetic drugs and could affect blood sugar control. And sodium glucose cotransporter 2, SGLT2 inhibitors, which are a relatively new class, very good class. A new study just came out in the last couple of weeks saying that these are actually been shown to help cardiovascular conditions in diabetics. So the SGLT2 inhibitors may increase serum magnesium levels and may cause hypermagnesia, and caution should be used with supplementation. So there you go. And that's it for magnesium. Any questions on magnesium before we get going? Ralph, I'll answer your question afterwards. Thank you. Okay. Let's go on and talk about our herb of the day, Gou Teng or Uncaria. This is from the family Rubiaceae or madder family, which we're going to talk about in just a minute. There are a lot of standard species here. So according to Bensky, a whole bunch of species can be considered standard. Uncaria, Rhynchophila, Mick Jacks, which are the biologists, and that's standard Gou Teng. That's sort of the standard one that I've seen the most in the literature is Rhynchophila. So Uncaria Rhynchophila. Uncaria macrophila, Wall is Daye Gou Teng. Uncaria hirsuta Havel, Gou Teng, Uncaria sinensis, olive havel, Gou Teng, and Uncaria Sicily fructus, Roxby, Bing Gou Teng. So Bing Gou Teng. These are all standard species of this herb. The English translation of Gou Teng is hook vine, or like the way Chen Chen had both hook vine or hooky branches. I kind of like that, hooky branches. Other names include cat's claw, which may be confusing and applies to another species. So I wouldn't use cat's claw necessarily in this, because it usually means it's an Uncaria, but it's a different species of Uncaria, used more in South America. Fish hook vine, Nen Gou Teng, Gou Teng, Go, and in Japanese Kodo, and in Korean Kudyong. Again, I don't pronounce Chinese very well, but at least I have some experience. I have none with Japanese and Korean. Let's talk about that Rubiaceae family real quick. The Rubiaceae, or madder family, consists of 611 genera and over 13,150 species. I'm actually a little bit concerned. No, this is all correct. They are herbs, shrubs, and trees, mostly in tropical areas. Actually, yep. They have opposing leaves with stipules or in whorls with unbroken leaf margins and leaf-like appendages at the base of the leaf stalks. Leaves usually are large and evergreen in tropical species, deciduous in temperate species, and needle-like or scale-like in different species. Sorry, I'm going to just check out one thing real quick here, make sure I didn't make a mistake here. Because I feel like there's a typo here that I need to be worried about. Oh, that is it. Okay. The plants may bear a single flower or many small flowers clustered together. The fruits may be berries, drupes, capsules, or schizocarps, which are dry fruits that split into segments of a single seed. The coffee, quinine, ipecac, kratom, and gambier used in tanning all come from or are extracts from members of this family. And many are also common ornamentals. Back to our herb Gou Teng, Bensky. Remember, we have 3 major textbooks, and they all have this. This is, like I said, a quite common herb. So Bensky says the dosage is 6 to 15 grams, and both Chen and Brown Wiseman say the dose is 10 to 15 grams. All 3 sources say prolonged heat can damage its properties, and it should not be decocted for more than 20 minutes. So one of them, Brown Wiseman, I think said add it towards the end of the decoction. The category of this herb, according to Bensky, he and their team put this herb in the substances that extinguish wind and stop tremors category. Chen and Chen say it's in the liver calming and wind extinguishing herbs category. And Brandon Wiseman actually has it in a subcategory. It says it's in the wind extinguishing, tetany relieving medicinal subcategory of the liver calming and wind extinguishing medicinals category. So they're a little bit more specific about this herb. All 3 of our sources say it is sweet and enters the liver and pericardium channels. Both Bensky and his team and Brandon Wiseman say it is slightly cold, while Chen and Chen say it is cool. Essentially, these all mean the same thing. What's the difference between slightly cold and cool? I don't think there's much of a difference there, but a slightly different terminology here. History of this herb. Both Bensky and Bensky and his team and Chen say the original source for this herb is miscellaneous records of famous physicians, or the Mingyi Bei Lu, as described in Bensky, or the Mingyi Zaju, as listed in Chen. In other words, the English translation was the same in both books, but they had different Chinese in them, and that happens sometimes with Chinese books. So I don't think that's a huge discrepancy, but it's interesting that it's in these books. But they both agree it was written around 500 CE. They all said circa 500, so around 500 CE. So it's an older book, but not our oldest on single herbs. So let's talk about this category. Again, Bensky has great introductions to these categories, and Bensky and his team says, wind, a pathogenic influence, has both exterior and interior manifestations. The substances in this category are used for treating wind in the interior, also known as internal stirring of wind. Interior wind usually results from pathogenic changes in the functions of the organs, principally the liver and kidneys. It can arise from yin deficiency of the liver and kidneys, ascendant liver yang, blood deficiency, and high fevers. Internal stirring of liver wind is usually caused by yin deficiency of the liver and kidneys or ascendant liver yang. Manifestations include headache, dizziness, blurred vision, tinnitus, that's the ringing in the ears, and in severe cases, irritability, vomiting, palpitations with anxiety, and muscle twitches. Treatment is directed at nourishing the liver and kidney yin, calming the liver, and extinguishing the wind. The progression of this pattern, which includes tremors, tonic-clonic spasms of the extremities, sudden loss of consciousness, facial paralysis, hemiplegia, aphasia, and similar problems, is called wind stroke or zhongfeng. In treating these problems, substances are used that extinguish the wind, stop the tremors, and transform the phlegm. These substances are thought to improve the circulation and hasten the recovery of nerve tissue. Extreme heat that produces wind is manifested in convulsions or opisthotonos due to high fever. If you've never seen opisthotonos, that's like an arching of the back, a stiffening of the body. That's opisthotonos, and it's usually quite serious of an issue. This pattern is called childhood convulsions or jingfeng, literally fright wind. It can occur in any disease with high fever, as well as infections of the central nervous system. In treating this pattern, substances which clear the heat and stop the convulsions are used. Blood deficiency that produces wind is characterized by dizziness, blurred vision, tinnitus, and numb extremities or paresthesias. In severe cases, it can present as convulsions or loss of consciousness. In treating this pattern, substances which extinguish the wind are added to those that nourish the blood. That was our introduction to this category. Again, if you have any questions, feel free to unmute yourself or put it in the chat box. Happy to answer any questions. Let's talk about good quality of this herb. Bensky and their team say good quality has solid anchor-shaped twin hooks and a small number of thin stems without hooks. The surface should be purplish brown or reddish brown and glossy. I have another book called The Chinese Medicinal Identification and Illustrated Approach by Zhao and Chen, which is all about good quality. So they say Gou Teng has a cylindrical or semi-rectangular columnar shape and a hard and pliable texture and a fibrous cortex. There's no odor, and the taste is, quote, pale. I don't know what a pale taste is, but they say it's a pale taste. Superior medicinal material has double hooks and thin stems. The hooks are firm, and the medicinal material is smooth, tender, and purplish red. So what does this herb do? Chinese medical actions. According to Bensky and his team, Gou Teng extinguishes wind and alleviates spasms for patterns of liver heat with internal stirring of liver wind with such symptoms as tremors, seizures, and eclampsia. It also drains liver heat and pacifies liver yang for liver fire and ascendant liver yang patterns with such symptoms as headache, irritability, red eyes, and dizziness. Recently used for hypertension, especially of this type. And finally, it releases the exterior for exterior wind heat patterns with such symptoms as fever, headache, and red eyes. Chen and Chen say it extinguishes wind and alleviates spasms. And it does this from two sources. So one of those is liver wind. Actually, it says liver wind is the big issue here. Gou Teng, Ramulus Uncaria Uncis is essential in extinguishing wind and sedating fire. For stroke, liver wind in combination with phlegm may result in sudden stroke, fainting, facial paralysis, hemiplegia, or loss of the ability to speak. It also clears heat and pacifies liver yang. Rising liver yang can result in headache, feelings of distension in the head, dizziness, vertigo, and hypertension, tinnitus, insomnia, heavy-headed sensations, and involuntary muscle twitching. Brown and Wiseman say it extinguishes wind and checks tetany and clears heat and calms the liver. They also say in recent years, Gou Teng has been used extensively in the treatment of hypertension. Again, hypertension. Not surprisingly, because Eric Brown is one of the editors, the Chinese Medicinal Identification and Illustrated Approach very similarly says Gou Teng extinguishes wind and relieves tetany and clears heat and calms the liver. Preparation. So Bensky et al. Discusses preparation. For this herb, young tender stalks called tender Uncaria vine or Nen Gou Teng are favored. The hooks may be single or double. The double hooks are preferred and are known as paired Uncaria vine or Shuang Gou Teng. When the stalks are removed and only the hooks themselves are used, it is called Uncaria hooks or Go-Go. Here again, the double hooks are considered best and are known as paired Uncaria hooks or Shuang Go-Go, paired Uncaria Shuang Go, tender Uncaria hooks Nen Go-Go, or clean Uncaria hooks Jing Go-Go. Okay, a lot of go-go. Although the actions of the vine and hooks are the same, the hooks are believed to have more concentrated aroma and more powerful therapeutic effects. Treasury of Words on the Materia Medica, or the Ben Sao Hui Yan by Ni Ju Mo, written in the Ming Dynasty, which went from 1368 to 1644, advises removing the stalks and using only the tender hooks. The effect increases 10 times in power. There you go. Western uses. The PDR for Herbal Medicines discusses gambir as a traditional herb used in the West. It says it is astringent because of its tannins, which are also said to have antibacterial and algicidal effects. In other words, they help algae. Bacteria, it has antibacterial, antibacteria, and algicidal, anti-algae effects. Its flavonoid fraction is said to be hepatoprotective. In other words, it helps the liver, it protects the liver. Unproven uses include treatment of diarrhea, nausea, and gastrointestinal disturbance as a tincture, while a decoction is said to treat peptic ulcers and ulcers of the oral mucosa and asthma. So interesting, very different uses. All right, let's get into some commentary on this herb. Again, Bensky does a great job. Bensky and his team does a great job. Has an excellent commentary on this herb. Uncariae Ramulus Uncis Gou Teng is sweet, slightly cold, and enters the liver and pericardium channels. The liver governs wind, and the pericardium governs fire. Wind and fire can provoke each other to cause such disorders as childhood convulsions, dizziness, and headaches. Because this herb is light, clearing, and cooling, not only draining fire, but also settling wind, it can treat such patterns as extreme heat generating convulsions and liver channel heat, or ascendant liver yang leading to dizziness, headache, and red eyes. It is particularly appropriate for childhood convulsions. Because of its light, clearing, and draining nature, it is also used for externally contracted headache and red eyes, or for spots and rashes that fail to surface. Treasury of Words in the Materia Medica states that it is swift and sharp by nature. In an instant, it can expel wind phlegm, open block qi, or quiet down childhood convulsions. However, if decocted for long, it has no power. After the other herbs have boiled sufficiently, put it in and immediately lift the pot from the stove so it will be at its strongest. Chen Shi Duo warns that it should be used with an eye to treating the root of the condition, explaining in a new compilation of Materia Medica, the Ben Sao Xin Bian, written in 1694, that it very quickly eliminates wind and must be used for internal wind patterns. However, the generation of wind fire is usually caused by insufficiency of kidney water, which leads to dryness of wood and fire blazing. Using a little bit of Gou Teng among herbs that tonify the yin readily disperses the wind fire. If one does not tonify the yin and only uses Gou Teng to eliminate wind and disperse fire, the wind will not be extinguished and the fire will flare even more. In rectification of the meaning of Materia Medica, the early 20th century writer Zhang Shan Lei says that it was considered an excellent herb for children in the earlier Materia Medica texts, and that it is in fact quite well suited for this by nature. It is light and clearing, with a sweet, cold nature that is most appropriate for constitutions with the not yet filled childish yin and the readily exuberant childish yang. He goes on to explain its ability to treat childhood convulsions. The reason that it can treat convulsions is that seizure disorder is an illness caused by liver blazing and generating wind, qi, and fire blazing upward and surging into the neurons of the brain. This substance is light in weight, clearing and cooling, able to drain fire, and also to settle wind. Chen and Chen also have an interesting commentary, most of which will be discussed under comparisons. Gou Teng has a sedative function, but not a tranquilizing one. So that's really interesting to distinguish. It helps to calm the Shen or spirit, but does not treat insomnia. Interesting. All right, comparisons with other herbs. So Bensky compares this herb with two others. The first is chrysanthemum floss or juhua. Both herbs calm the liver and disperse pathogenic wind heat, and both are used for patterns such as wind fire ascending along the liver channel to cause headache and dizziness, or for externally contracted diseases leading to headache and red eyes. However, Gou Teng primarily extinguishes wind and stops seizures, while chrysanthemum floss juhua inclines toward dispersing wind and draining heat. The other herb in Bensky's et al.'s text is Sagae Tatarake Cornu, or Lingyang Jiao, not an herb I'm particularly familiar with. Both herbs calm the liver, extinguish wind, clear heat, and settle convulsions and jitteriness. They are often combined in patterns of excessive heat, stirring up wind and causing convulsions, or in patterns of heat in the liver channel with ascendant liver yang, leading to headaches and reddened eyes with dizziness. However, Sagae Tatarake Cornu Lingyang Jiao, being salty and cold, enters the blood level to cool the liver and extinguish wind. It has a strong ability to clear heat from the blood and resolve toxicity, and thus it is also used for heat in the blood, with overwhelming toxicity leading to rashes or for measles sinking internally. Gou Teng, by contrast, is light in weight, clears, dredges, and drains, and is thus also used for externally contracted headache and red eyes, or for spots and rashes failing to emerge. Chen Chen also compares Gou Teng with some other herbs. Gou Teng and Rendang Teng, Callus lunisrae, both treat wind. Gou Teng is stronger in treating twitching and spasms caused by liver wind and liver heat, while Rendang Teng relieves pain due to wind heat in the channels and collaterals. Gou Teng and Tian Ma, Rhizoma gastroidea, both which are often used together, both pacify the liver, extinguish wind, and treat twitching, spasms, convulsions, dizziness, and headaches caused by liver wind. And as I mentioned, these herbs are frequently used together in clinical settings. Gou Teng is cold and has a stronger effect to extinguish liver wind by clearing rising liver yang. It's often used for liver wind secondary to rising liver yang in cases such as convulsions with high fever. Tian Ma is neutral and rich in oil. It does not clear heat as strongly as Gou Teng, but is stronger in relieving pain as the oil moistens dryness and helps to extinguish wind. It is more commonly used to stop pain associated with headache, vertigo, twitching, and spasms caused by liver wind. And this is also used in combination. Bensky actually combines this herb with many others for specific conditions, despite not having its usual subheading of combinations. Since there are a lot of these, there isn't the usual excellent explanation of how the combination works. We will not go into them today. There's just a lot of them and very specific and not a lot of explanation. So it's like, for this condition, use Gou Teng with these two herbs, and that's all I would say. It doesn't explain why they work. So we're going to skip it. There's too many for us to talk about anyways. We already have a pretty jam-packed full podcast today. And both Chen Chen and Brandon Wiseman similarly discuss quite a few specific combinations without a lot of commentary. So while there's lots of combinations, I didn't think there was a lot for us to bring up here. But again, Just Chen Chen has just mentioned in a comparison, it discusses the important combination of Gou Teng and Tian Ma. That's a very common. In fact, there's a whole formula, Gou Teng Tian Ma Tang, which is those two herbs, I think with other herbs, I'm sure with other herbs. But that's a common combination, and we did discuss that combination a little bit with the comparison. Contents. According to Bensky and his team, the contents of this herb include many alkaloids and flavonoids, which differ slightly depending on which specific species we are discussing. The alkaloids rhynchophyllene and isorhynchophyllene seem to be important components of this herb. Remember, that is the main species, standard species, is Uncaria rhynchophyllene or rhynchophylla. And so whenever you see that, chemicals named after the species, that often is an important determination of that species and probably plays a role, at least for us, medicinally. Chen Chen also had the following constituents, and of course I had to do this to myself, so please bear with me as I tried to pronounce all these. Crinoxine, isocrinoxine, corinanthine, dihydrocorinthiene, hirsutine, hirsutine, hyperin, and trifolin. Okay, I did my best. Science. According to Chen and Chen, the pharmacological effects of Gou Teng include it being an antihypertensive as shown in a human study with 245 subjects. That's a pretty good sized study. Central nervous system suppressant based on a mice study. That doesn't mean it does anything in humans. Anti-seizure in guinea pigs and in rats when combined with Tian Ma. Okay. From a Chinese perspective, we know it's anti-seizure, but I'm not saying guinea pig and rat. Again, animal research is good to point us in a direction for us to do human research, but animals and humans are not the same. And so you can't take an animal study and say, this is how it's going to work in humans. It has to be tested. It's a uterine suppressant, again, based on a rat study. And another study they talked about was an herbal decoction of several herbs, including Gou Teng Chuan Tui, which is the locust shells, and boha, or field mint, was helpful for treating infantile night crying. The N here was 18. There's only 18 subjects in this study, which means it's not statistically valid. You need at least 30 to 40 to run appropriate population statistics. So anything less than that is not considered statistically valid. But it's an interesting sort of thing. It's hard to get, by the way, it's really hard to get infants on a study. That's just not something that we do much in the West. So it's because of it comes down to that they're compromised subjects. They can't speak for themselves. We tend to avoid doing studies on those if we can. We can do observational studies, but we can't set up research studies like this would be. So anyways, interesting study. Let's talk about drug-herb interactions. There are a couple low evidence interactions involving this herb, but they remain theoretical. It may potentiate anticoagulant and antiplatelet effects and should be used with caution in patients taking anticoagulant and antiplatelet agents, thrombolytic agents, and low molecular weight heparins, and it may reverse caffeine's stimulating effects. Both of these were D-level evidence, lowest level of evidence. Take them with a grain of salt. They're there. Usually I like to look at the American Herbal Products Association's Botanical Safety Handbook, which usually has most of the herbs that we talk about and is really a great source, but it has entries on 2 different Uncaria species, but neither of them appears to be Gou Teng. So they had a totally different Chinese name than I've seen before for one of the species. The other one had no Chinese name at all, and they're usually really good with their Chinese names, Gardner McCuff and the APA's Botanical Safety Handbook. So I kind of said neither of the 2 Uncaria species was this one, so they didn't really have an entry on this herb, in other words. There are some concerns. Bensky and his team note several concerns with Gou Teng. Under the heading of cautions and contraindications, They say use with caution in the absence of wind heat or heat from excess. Under the heading of traditional contraindications, they say its nature is somewhat cold and should not be taken by those without fire. Because it is light, raising, and enters the liver, it may incite liver yang to rise up, and in rising, carry with it turbid pathogens to cloud the clear orifice. This comes from Harm and Benefit in the Materia Medica of the Bensao Hai Li by Ong, written in 1893. And they have a quote from another book. Deficient patients should not consume it as it is most capable of pilfering the qi. And this is written in the new compilation of Materia Medica of the Bensao Xin Bian, written in 1694. Neither Chen nor Brown and Wiseman has significant cautions regarding this herb, and as we mentioned, the American Herbal Products Association Botanical Safety Handbook does not have an entry on this herb. So not a lot of other cautions for us to consider here. Okay, and with that, we're going towards the end here. So in summary, we started today by looking at three very important macrominerals: sodium, chloride, and magnesium. We looked at the biochemistry and the supplementation and the Chinese medicine of these three macrominerals. Then we looked at the Chinese herb Gou Teng, Uncariae Ramulus Uncis, or Uncaria. We saw how useful this herb is in treating wind and liver heat from a Chinese perspective, and spasms and convulsions, and especially hypertension from a more biomedical perspective. And we spent a good amount of time discussing these intricacies, including preparations, cautions, and comparisons to other herbs. And with that, we include another exploration of a very useful Chinese herb. In our next episode, we will be looking at another herb of the world, in this case, Boswellia serrata, or Indian frankincense. This herb nourishes the heart, enriches yin, and calms the spirit. As always, we will do our deep dive into this herb and look at its traditional uses and its preparation, interactions, and cautions. And as usual, we will be adding something a little different. It's going to be another interesting expedition into the lesser-known universe of herbs. Please join us. It's going to be good. And I'd like to thank you very much for listening to this podcast. If you like this podcast, please do us a huge favor. Subscribe in your favorite podcast app. You don't know how much that helps us, and we really do appreciate it, and we thank you in advance, even just for considering doing so. And you can get this course as continuing education and get more info on my upcoming integrative nutrition series at www.integrativemedicinecouncil.org. And you can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. That's SPERBSHERBS.com. And, I don't mention it, but, you might think there's some really strange colors. A lot of you on the podcast don't see this, but when I do a presentation of this, there's a picture of the herb on the first page. It has a bunch of weird colors behind it, and I've created this whole code of colors that talk about the taste, the temperature, and what meridians it enters. And so that's what that color code is about. And here I have a slide that just says what all the different color codes are. I don't usually discuss it, but there it is in case you're interested. They're kind of ugly, but there's some sense to it. And as usual, I have a good bibliography, and I appreciate you guys being here today. Thank you very much. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy Dobbins,
Rogers,
Campbell,